So I think with regard to total ankles, it's important to have proper indications, and I think if you operate it on the right person for the right reason, and stick to those indications without varying, that increases your likelihood for success. So certainly important to have realistic patient expectations, limitations in terms of high impact activity. Clearly, since we're talking about bone ingrowth implants, any sort of talar body osteonecrosis is not going to be a good idea, not going to work. Important to have intact protective sensation and then a reasonable soft tissue envelope. So is there a limit in terms of coronal plane deformity? There's not really any consensus in the literature, but in general, it's roughly around 25 degrees. However, this is kind of poorly defined in terms of intra-articular versus extra-articular deformity and whether it's flexible or fixed. And so essentially, is that going to mean adjunctive soft tissue versus bony procedures? These are different implant systems, and some studies were single stage versus two-stage type procedures. So really, we're trying to compare apples to oranges, and it's really not legit that way. So, should we chase the x-ray? In other words, should all underlying foot deformities be corrected? And I think a lot of that kind of depends whether it's flexible or fixed. And so here's an example of a guy with bad ankle arthritis, and he's flat, but he's always been flat. His other side's flat. He's flat. That's his normal. He has a normal functional posterolateral tendon and isolated ankle arthritis. And so should there be, corrective osteotomies and so forth to make his foot more ideal on an x-ray just because?